My name is Dr. Beintaris. I'm one of the gastroenterologists from Northeast Hospital. Today I'm going to walk you through your upcoming endoscopy procedure. Your medical team or surgical team has referred you to endoscopy because they feel you may be experiencing a gastrointestinal bleed. Endoscopy is a procedure indicated in the majority of these situations in order to assess and treat for potential bleeding spots from either your gullet, your stomach, or the first part of your small bowel. You need to be aware that gastrointestinal bleeding is a potentially serious situation that may require emergency treatment. So what will happen before your procedure? Your medical team will kindly ensure that you have remained fasted for at least 6 hours before the procedure starts. It is also important, and the medical team will ensure that you have received acute emergency medical treatment in order to feel and be as stable as possible before you undergo endoscopy. So what happens during your endoscopy procedure? We will be using a camera in order to inspect your gullet, your stomach, and the first part of your small bowel, medically called duodenum, for a potential cause for your bleeding. We normally administer local anesthetic, what we call throat spray, in order to make the procedure easier for you. And upon discussion with your doctor at the endoscopy unit, you will also be offered the possibility and the option of conscious sedation. This is a medication to make you feel a bit more relaxed and make the procedure easier for you and more efficient for the operator, your endoscopist. The procedure normally takes anywhere from 5 to 10 minutes. There are several reasons that may cause bleeding from your upper gastrointestinal tract, your gullet, your stomach, or your small bowel. Some of the most common reasons might be an ulcer or what we call esophageal varices, i.e. dilated veins that may need treatment. About 9 out of 10 of the times, endoscopy is in a position to stop your bleeding. There are some occasions where we are not able to do so, mainly because the bleeding spot may not be accessible by the camera, or it may be too advanced for us to treat it by means of an endoscopy, a camera procedure. In that case, we might need to escalate your treatment with one of our colleague surgeons, or even discuss other minimally invasive options for you, such as a scan with potential interventional radiology treatment. So what are the risks involved in you having an endoscopy in order for us to be able to stop your bleeding? As with any procedure, you should be aware there are risks that, although they're not that common, they do occur. Risks involved in endoscopy for upper GI bleeding purposes involve further bleeding during the procedure or inability for us to stop your bleeding, a small risk of a tear in the bowel lining, what we call a perforation, as well as a risk of a chest infection as a consequence of your procedure. So what will happen after your procedure? Following your procedure, you will be escorted to our recovery area where one of our qualified nurses will assess you and ensure you remain as well as possible after your endoscopy procedure. We will go through steps after endoscopy to continue your bleeding treatment with you and your medical team or surgical team if appropriate, in order to ensure that adequate treatment has been definitively offered to you. There is always a small chance that your bleeding recurs. These are rare occasions, but you need to know that if that is the case, we may need to discuss again with your consultant and your team to see if repeating an endoscopy or escalating to different treatment modalities is appropriate for you.